If you want to get an A on your upcoming nursing exam, keep watching. First, let's talk about the big one, which is potassium. It's really big and important in nursing school because potassium imbalances are directly related to the heart. Easy way to remember that potassium is directly linked to the heart is to remember that potassium on the periodic table is K, and just think that K is king of the heart. So too much or too little potassium is going to throw off the heart's royal rhythm. So first, let's talk about hyperkalemia, which is high potassium. A few causes of hyperkalemia could be renal failure, diuretics that are potassium sparing, or just excess intake of potassium in general. Some symptoms that you will see is muscle weakness, excess fatigue, you'll see abnormal heart rhythms, or even cardiac arrest. To treat hyperkalemia, they will use K-exalate, insulin with glucose, diuretics, or the patient may need dialysis. So first, let's talk about hyperkalemia. And to also help you kind of remember that, remember we said that potassium is K on the periodic table. K is king of the heart. So our hyper king is overworked. His muscles are weak, his heart rate is slowing down, and he is fatigued. Mnemonic to help you remember hyperkalemia, you can just think that the king is murdered. So murder. M stands for muscle weakness. U stands for urine production is low or even none. R stands for respiratory failure. D stands for decreased cardiac contractility. E stands for early signs are muscle twitching and muscle cramps. And R stands for rhythm changes. So you'll see heart rhythm changes on the ECG. So putting all that little story together to help you remember hyperkalemia, K is on the periodic table, that's potassium. K is king of the heart. So then we have hyper king who's overworked, his heart rhythm is changing and all kinds of crazy things, and he gets murdered. That's an easy way to help you remember hyperkalemia, and follow me for part 2 where we go over hypokalemia and its signs and symptoms plus easy ways to remember it.